I would say that we're living in a time currently of both great challenge for healthcare, but also great opportunity and innovation across the globe. We've just come out of the COVID-19 pandemic, which saw great crises for healthcare in different global contexts. Humanities and social science experts are vital in coming up with solutions to problems facing health and healthcare, because they show the cultural, historical, socio-political, the human experience of everything to do with what it means to have an illness or be treated for an illness. This programme is all about imagining the healthcare futures of tomorrow. It allows students a space to really carry out some of that blue sky thinking, to imagine what does the healthcare of the future look like, what do the hospitals of the future look like, what do the patients and doctors of the future look like, and how can we use the arts, humanities and the social sciences to create and imagine those futures.
What's unique about the programmes is that they're interconnected, although each of them has its distinctive approach and knowledge that's associated with it. The students who take these programmes will initially gain a great foundation in the topic that they're studying. They'll develop their knowledge, and then they will move on to interconnected modules that all the students from across the programmes take on topics such as leadership and working with strategic external partners.
The medical and health humanities are a fast-growing and interdisciplinary field which approaches diverse questions relating to health and healthcare from different disciplines to tackle some of the main problems today facing health and healthcare in different contexts. What we mean by global medical and health humanities is thinking about how that differs in different global contexts. However, we're also now looking currently at sites of innovation such as hospital design. So in the UK currently we have the New Hospitals programme, which is all about designing and building the hospitals of the future. We have AI in healthcare. There's a huge amount of innovation going on currently. Health inequalities are also a big problem in healthcare. So whether that's inequalities relating to race or sexuality or gender, any barriers basically that stop you from accessing healthcare is a problem that we want to find solutions to. One of the questions we might look at, for example, is how do different artworks help communicate the experience of illness or disability? How can we learn about what it's like to have a certain illness or a certain disability? So we can see that in literature or in film or in the arts more broadly. I'm currently working on a project in which philosophy and design are coming together to imagine the healthcare environments of the future. I think what this course does is to empower people from all different disciplinary and professional backgrounds to make an impact within health and healthcare. So whether you're wanting to work in healthcare activism, for example, or patient advocacy, or you want to understand how arts can help us explore and describe the experience of illness and disease, or you want to make healthcare more inclusive to people from all different backgrounds, sexualities, ethnicities, or social groups, then this course really does show that we need a very wide range of perspectives and different expertise and skills. One of the key elements of the course is that we have studio modules at the core of the course, and students will be collaborating with other students in teams in those studio modules in order to react to a live brief. For example, you can imagine students coming into that studio module and being given a brief to help hospital designers come up with a way to make certain spaces or wards, for example, more inclusive to particular groups of people. So those students would then work together in an interdisciplinary group to come up with solutions to those problems and to communicate those problems to real people working in the industry. So for me, that's what really stands out about this course, is the way that this course navigates the power to turn those theoretical insights in the medical and health humanities into practical impact within the real world.
We see leadership as being a set of skills that allow you to really create change and to make change happen, whether that's in a kind of management role, like being a CEO or the manager within a company, or whether it's working within your community, maybe in a role like activism or community leadership. Anything that helps people turn their ideas and their skills into something which improves people's lives is, I think, what leadership really means.
I think the emphasis on leadership is also a real standout part of this course. So this course, I think, gives people the tools and the experience and the confidence, but also the networks and the connections to really lead on some of these innovations in the field. The content that students will be exploring in the classroom will be from research that is being actively conducted currently by cutting-edge experts in the field, be that experts in the history of psychiatry or the philosophy of illness or the sociology of healthcare or the architecture of the hospital, etc. These are people that can bring experience and knowledge of the projects that are currently ongoing into the classroom. And students in the classroom will be able to participate in those discussions and hear about the experience that those researchers have brought back from those projects, and hopefully feed into as well discussions surrounding those projects. After the MA, you might be interested in a role in healthcare advocacy, in healthcare journalism, in healthcare policy, think tanks. You could work for a charity or an organisation. You could go on into education. You could continue in research and go on to do further postgraduate research in health and health humanities. There's a wide range of career options that you can go into. I think this MA really does empower students to become engaged in health and healthcare, whatever their academic or professional background might be. Sometimes I encounter students undergraduate level who have done a humanities subject, for example, and who have a real passion for, say, disability rights or disability activism or LGBTQIA+ rights in healthcare, etc. But they're not sure how to translate that undergraduate degree in the humanities into real practice in the real world. So I think this MA can really empower students to translate whatever experience or professional or academic background they come into it with into skills that they can use in real healthcare contexts.